Here's the deal. In 2023, North Carolina expanded Medicaid coverage for low-income adults, allowing over 600,000 new people to enroll. For a brief period, one of those people was me. When I was between jobs, Medicaid expansion covered my healthcare. My name is Abe Kenmore, and I'm partnering with Get Real, America's first grassroots newsroom. At the beginning of July, Congress passed the One Big Beautiful Bill, which includes significant changes to Medicaid nationally. These include a new work requirement, more frequent checks to see if people are eligible for those benefits, and changes to the complex formula that states and the federal government used to work out who pays for what. Over 10 million people nationally could lose Medicaid, and while it's not yet clear how many people in North Carolina would be impacted under the final bill, under a prior version, an estimated 300,000 people could lose their coverage. I spoke to one advocate who works with people in recovery, many of whom are on Medicaid.
The Big Beautiful Bill has affected a lot of my consumers. It's cut a lot of the funding that comes into my county, which is a trickle-down effect and cuts out the resources that my clients desperately need. It will definitely affect their ongoing access to Medicaid. Without Medicaid, I really don't know how they'll be able to continue with their independent living skills.
North Carolina has a Republican-controlled state legislature and a Democratic governor. To get a bipartisan agreement on Medicaid expansion, lawmakers said that the whole expansion program would be ended if federal funding ever dropped below the 90% level that was promised. So now, without action from the state legislature, the changes from the Big Beautiful Bill could trigger the end of expansion altogether. What do you think? Do you know anyone who's worried about their Medicaid or has used the expansion program?